nickname is Lorazepam, but some people call me Ativan. It's considered my trade name. I come from the planet Benzodiazepine, which means my species classification is benzodiazepine. I help out your world's population by helping people with anxiety and insomnia. I can also help induce anesthesia and help with neural firing in someone who has a seizure disorder. How do you do what you do? Well, when I arrive on the scene, I can be in liquid form and be injected into a person intramuscularly. In emergencies or serious situations, I can be given intravenously. If someone needs me for sedation or induction of sleep, I can be given to them as an oral capsule. I tell them before entering their system to swallow me whole. My fans should be advised to take me with food if it upsets their stomach as well.
How should healthcare workers educate their patients when taking you?
Great question. They need to warn their patients not to increase the dosage or discontinue treatment without consulting the prescriber. Use intermittent dosing and the lowest dose possible to minimize physical dependence when treating insomnia. Inform patients about the possibility of complex sleep-related behaviors and instruct them to notify the provider if they occur. Advise them to avoid hazardous activities, for example, driving, if daytime sedation is significant. Warn patients against abrupt discontinuation of treatment. This can cause withdrawal. Warn patients against the use of alcohol and other CNS depressants. The intensity of withdrawal symptoms can be minimized by discontinuing the treatment gradually.
We're going to have a commercial, so it'll be a short break.
I'm so nervous.
Are you feeling anxious?
Yes!
Lorazepam's here to help. I'm gonna give you 4 milligrams of lorazepam and your anxieties will be gone.
Wow!
Nurse Leah here, and she's going to talk about how lorazepam works in the body.
Hello guys! Lorazepam's effects are due to its strong ability to bind to the GABA benzodiazepine receptor complex, which enhances the affinity for GABA, a neurotransmitter that blocks impulses between nerve cells in the brain. Low levels of GABA have been linked to anxiety, mood disorders, seizure disorders, and pain. In other words, it is a CNS depressant. When people need it for anxiety, it works on the limbic system to decrease it. They promote sleep through the effects on cortical areas and on the sleep-wakefulness clock. Lastly, for seizures, it inhibits the excitatory firing to stop the seizure activity.
Thanks for your help, Nurse Leah.
Anytime. Bye.
Let's welcome back Lorazepam.
Hello.
When it comes to dosage, how much of you do people actually need?
Well, great question. Once I'm in their system, I last for about 72 hours. In emergency situations, I should be given intravenously at a maximum rate of 2 milligrams per minute. For people who need my help every day, they can take me in tablet form or intramuscularly. That dosage can range from 2 to 4 milligrams per day.
Wow, I bet you're helping millions of people out there. We actually have someone here today that you help out.
Oh my gosh.
Let's figure out.
Okay.
Come take a seat.
Hello, everybody.
Oh, hello, Miss
Hello.
Lee. So why don't you just give us a little backstory?
I am an old woman who has liver damage. Oh my God. I know.
So hard.
And I take lorazepam because I also have a seizure disorder. And it works wonders. Thank you, lorazepam.
You're welcome.
Oh.
Goodbye.
Bye.
Isn't she so cute?
Yeah.
Is there anyone you can't save?
I could actually be harmful to people who are pregnant. My magic, as you say, is considered to be a pregnancy category D, meaning studies have shown that there's proven risk to fetal harm. But the potential benefits of using during pregnancy may be necessary for some pregnant women despite the risks.
So, after all of this, let's see how the crowds feel. So, how do you feel about Lorazepam?
I think she cannot be trusted. She can sometimes make people do funny things while they are asleep, like driving, eating, and making phone calls. Lorazepam can also cause CNS depression, causing a decrease in respirations that could be lethal. It could lead to a coma and death. This risk is especially high if taken with other CNS depressants. So if people use opioids, barbiturates, or antihistamines, they could also have respiratory arrest. Sometimes Lorazepam's crazy superfans can't get enough of her and they become physically dependent, which could be avoided if they would take the smallest dose. She also can't be trusted if people are taking alcohol or other CNS depressants as well. It's contradicted in pregnancy and for patients who experience sleep apnea.
Well, thank you for your input. Let's take it back to Lorazepam. Back with Lorazepam here, but sadly we're out of time. So it's nice seeing you all. Bye!